Our next speaker, Elaine Hill of the University of Rochester, will present early results on how the COVID-19 pandemic exacerbated the overdose crisis. Thank you.
Thanks for having me. I'm very excited to be with you all in person and those on Zoom or YouTube when they watch this later. This is a compilation of a number of papers that we're working on. So some of the details will not be as clearly presented as the last speaker. So I'm happy to chat after about details. And I was taking notes to reconcile possible differences between what was just presented and what we have done. So I look forward to having that conversation. Hello, friend. Why? Should just oh, there we go. Okay. These are my lovely collaborators that fit on a slide. And I would also like to just acknowledge a very large team at both University of Rochester, Indiana, and Wake Forest that made this presentation happen. We're very grateful for the funding, and I want to give a shout out to our NIH science officer, Tamara. She's been just amazing. So thank you for your engagement with us and your feedback. So it's not too surprising based upon the last conversation that drug overdoses have been increasing, especially during the pandemic. When we just look at the change from 2020 through April of 2021 compared to the same period from 2019 to 2020, this is an increase of close to 30%. This is drug deaths overall. But there's also evidence of increasing alcohol misuse. So some of you all in prior conversations over the course of the last year were asking about alcohol as well as mental health, and that's really engaged our team, and we've been looking into that as well. So we look forward to sharing results today and in the future on some of these other our grant is focused on opioid deaths, but we look forward to sharing poly substance use as well as alcohol. So for our project, our overall objective is to evaluate how the pandemic exacerbated economic and social vulnerabilities, including pre-pandemic individual and community level incidence and risk of OUD. And our hypothesis is that these social and economic vulnerabilities, as well as the economic side effects of the pandemic, escalated the prevalence of OUD and related harms. So I'm sharing a few research questions today, but this is the overarching theme of our project. So we're really trying to begin to unpack the various factors that could be playing a role. Many of you are thinking carefully about this in your research, including with mixed methods. Most of our research at this time is using secondary data. So we're really trying to think about individual factors, community, structural, and then how the pandemic layers on top of these nested factors. So today I'm sharing the following research questions or aims. The first one is we wanted to understand which populations were most affected by opioid or alcohol related harm. And so the way we're just starting to uncover this is to think about individuals that had pre-existing or are now new onset OUD, AUD diagnosis, and we look forward to unpacking more individual characteristics in the future. Our second question that we'll talk about today is looking at various locations that saw the greatest increases in opioid-related mortality. And so this question is most overlapping with the prior presentation. The last one is that we are interested in not just understanding how all these various system and economic factors may influence OUD, but we want to be thinking about how the infection may have played a role in changing the landscape of the population with OUD. So, it's some of you have seen this work before, but we've been in concert with some of the recover work that our team is doing, are thinking about risk factors associated with post-COVID pain and post-COVID OUD. So those three questions map onto these three data sets. So the first question, we are using a database of commercially insured and Medicare Advantage patients. And this has also been presented earlier today by another team. We are using the National Vital Statistics System through 2021, which was just presented through 2020. And then finally, we're going to share some results from the N3C that's already been mentioned today. So that's the data. We're kind of doing a research triangulation approach here. So first, from our commercially insured and Medicare Advantage patients, we wanted to try to understand how treatment is changing over time, and sort of that access to treatment. And so we are, looking at the percent of individuals who are diagnosed with opioid use disorder, and then those that are receiving medication for opioid use disorder. And we find, this is just descriptive, but we see that at baseline, close to 12% of those patients were receiving MOUD, which is a policy problem in and of itself. And there's many policy responses that are targeting that. And then this access reduced down to under 4% during various phases of the pandemic. We see something similar for alcohol, although it looks like perhaps during the pandemic, this has rebounded a little bit to be slightly above baseline. So, maybe a slightly different pattern for alcohol. So then we wanted to understand emergency department visits and these individuals who are at risk of overdose. And so this slide is focused on trends and looking at the rate of OUD and alcohol-related emergency visits. So the blue here on the left is OUD, and the orange on the right is alcohol. The straight line, the solid line, is baseline. So those are individuals who had OUD prior to the pandemic, and the dotted line are those that did not. And so, at least in a trend perspective, we see that some of the increasing risk of OUD ED visits is being driven by individuals who didn't have a prior diagnosis. And then we see something similar for AUD as well. So that's just the trend. But then if we're looking at, prevalence by baseline, we see that those who had a baseline OUD diagnosis and MOUD versus those that didn't have a baseline OUD, we see that the incidence was higher for those receiving MOUD at pandemic onset, which may indicate active or more severe illness. So we're really interested in unpacking some of the factors that may be driving this. So stay tuned for that. So now we're going to shift over to the National Vital Records for mortality. And here we propose to isolate communities that had higher pre-pandemic OUD overdose mortality, thinking that these communities are the ones that had the highest overdose burden prior to the pandemic, and they may be more susceptible or affected by the pandemic. And so here we're using an event study approach, and high is just above and below median in this first specification. And so looking out through 2021, we see that communities that had higher pre-pandemic opioid-related mortality, are the ones that are experiencing this shift and increase in mortality related to opioids during the pandemic. And there may even be an additional shift up in 2021. We're quite excited to get 2022 data and see how this is, but this is a crisis right now. This is happening right now. And, figuring out policy responses is essential. So, this is already a couple of years back, and we don't totally know what's exactly going on, but these communities were definitely hit. So then we wanted to understand how whether there was an incremental effect of shutdowns. And so here we're using a dummy for above median days closed during COVID at the county level. And so we're interacting that same event study that we just showed, but now adding in those communities that were more shut down during that initial phase of the pandemic. And we don't really see any additional incremental increase for those communities. So much of this is driven by, pre-pandemic vulnerabilities, and not necessarily the pandemic response. That's how we're interpreting it, but I think we need to reconcile it with the last presentation. So then we were interested in how COVID mortality may be playing a role. Perhaps people are experiencing, stress, and we all experienced it from the spread in our community. And so we now, in this specification, are interacting with communities that are counties that had above median COVID deaths. And here we do see an additional incremental increase for those counties. And so just to be clear, these are overdose mortality, but in communities that have higher COVID-19 mortality. So they were experiencing more COVID morbidity in the community, and then perhaps are affected by that, and overdoses are occurring. So we're interested in beginning to unpack this. I do want to just note that we do see more of a separation between the pre-period trend here, and it's a level difference. And so we're interested in understanding what the more factors and more community characteristics than just the binaries that we've done here, to try to understand why these communities did have a higher opioid mortality before the pandemic than those that, so there's some correlation there that we need to unpack. Okay, so how does this all fit together with us then thinking about post-COVID pain? Well, we're thinking, okay, so there's communities that had pre-existing vulnerabilities, and there's also the potential for these individuals who didn't have OUD before to be having more overdose ED visits, and we're seeing this increasing trend. And so, we wanted to begin to ask the question, do we see increased risk of pain and or OUD after infection? And then we want to unpack some of those risk factors. And so here is a logistic regression with our forest plot, and we find a number of comorbidities and demographic characteristics that are associated with increased risk. So these are individuals who didn't have pain before they had COVID index and then are developing post-COVID pain. We also look at this for OUD, and we see something very similar. Many of these risk factors reflect sort of the severity of COVID. And so, I think we need to use that research triangulation method to bring all of these results together into a cohesive package. But some of our next steps are to start to understand more factors that could be differentiating the individuals and the communities, and then also following these patients, once we see that they have developed post-COVID pain or OUD, what are their risk of overdose? So then we can link it all together. And then our more longer term interest is in understanding mid to long term effects. And we also are beginning to just unpack some of this in the 100% Medicare and Medicaid claims. So we're really excited to collaborate with the consortium members and work together to begin to understand this. So thank you so much.